Welcome back, ladies and gentlemen. For those of you that don't know me, I'm Colonel Pat Looney. I'm the Deputy Director for the Center of Leadership and Ethics, and essentially Colonel Gray's number 2. So this plenary session is dedicated to one of our outstanding alumni, Caroline Dawn Wortham. The speaker for this session represents the high quality of leadership and scholarship in their field that Carrie Wortham role modeled as a core for the Corps cadets. I would like to recognize her father, Ed Wortham, who is here for this event. Carrie Wortham, via my class of 12, had the ability to positively impact others in her life, which was unfortunately cut short by a car accident in 2015. She was one of those leaders who continually stepped up her game to meet the challenges and routinely set an example. Whether competing in track and field, serving as a team captain, a VMI cadet officer, all the while earning academic honors. Following her graduation, she dedicated her next 2 years as a servant leader working for Midwives for Haiti. For her love for and the service to the Haitian people, it led to the opening of the Carrie Wortham Birth Center in Cabestro, Haiti, shortly after her death. Her final months were spent in preparation to matriculate into the Marine Corps Officer Training Program. This year's Caroline Dawn Wortham leadership speaker is Captain Jan Rader. When most people think of crises, they think of something surprising or immediate. Our next speaker will share how she and her community tackled a different kind of crisis, a troublesome one that is slow-moving over time, the opioid crisis, and more recently, the fentanyl crisis. Jan Rader is very good at applying her many talents to adaptive, challenging problems. She joined the Huntington, West Virginia Fire Department in August of 1994 and became the first woman to reach the rank of chief for a career department in the state of West Virginia. Besides being a firefighter, she also earned a nursing degree. She holds many fire service certifications, has been a fire and EMS instructor in West Virginia. She is currently the director of the Mayor's Council for Public Health and Drug Control Policy in Huntington, West Virginia. Chief Rader came to national prominence after the release of the short documentary Heroin by Netflix in September of 2017. In April of 2018, she was chosen as one of Time Magazine's 100 most influential people in the world. Ladies and gentlemen, please join me in welcoming Chief Jan Rader.
Thank you, sir. Appreciate you. Well, I'm certainly honored to be here today, and I hope that Carrie, you're watching from up above, and that you're proud of what you will see today and what all the cadets today are learning in this wonderful leadership conference. It's kind of weird to see a big picture of yourself on the screen, by the way. I think we need to start with giving you a little background about Huntington, West Virginia. Okay, this is a story. I feel blessed and honored to tell the story that we have in Huntington, West Virginia. This is a lengthy crisis that will probably be going on for the next 50 years or maybe longer. I'll give you insight into how it transpired and how one small community is making a difference because of compassionate leadership. So Huntington, West Virginia is where Kentucky, Ohio, and West Virginia meet. Yes, it's right on the Ohio River. I'm considered a river rat. The town is only 46,000 people. The county, Huntington is the county seat of Cabell, 92K people living in the county. And we're mostly known for, anybody in here seen the movie We Are Marshall? Okay, Matthew McConaughey, he was in town. He's really good looking in person. But wonderful movie, and it highlights a plane crash that happened November 14th of 1970, where we lost 75 members of our football team and our community leaders. We lost 5 physicians in that plane crash. I think 35 children lost at least one parent in that one crash. And I think that's a significant part of our history and it makes us better at collaborating with each other because we came together to heal from that crisis or emergency, however you want to, whatever column you want to put it into. But I think that gave us a foundation to build on when we had another crisis that we were dealing with. We have 2 level 2 trauma centers in town. We have Cabell Huntington Hospital and we have St. Mary's Medical Center. And just FYI, on my days off from the fire department, because I, just had spare time, I worked as a nurse in the ER at Cabell Huntington Hospital. So we do serve a metropolitan area medically of about 360,000 people, and that's significant. Okay. So to give you a little background, a lot of this happened before you all were born. But it's important to know. There's a lot of movies out there right now. There's a lot of good books that I might mention throughout this slide presentation that you might consider reading if you have an interest in that, because it is a story that starts with greed, unfortunately, and it's ruining a lot of lives today. 2022, 110,000 people in the United States died of an overdose, and that is just unconscionable to me. In the late 90s, we had some new synthetic pain medication that was invented. Purdue Pharma was one of the producers, and it was called Oxycontin. Okay, it was marketed as less addictive or non-addictive, and it began being given out like candy. And of course, you have opportunistic people that pop up and they want to make some money. And so they opened pain clinics all over. There was this pain management explosion. Pain became the 5th vital sign, and as a nurse, that really drove me crazy because I can't measure your pain. Your pain is what you tell me it is, okay? I can measure your blood pressure. I can measure your temperature. But how can I measure your pain? So that's very subjective. Okay, so we had, I don't know if I had it on this slide or the previous one, there were millions of pills dumped into my county. I think it's on an upcoming slide. Okay, so we had this pain explosion, okay, pill mills everywhere. If you want to read about what fed Appalachia, read the book American Pain. It was written by a professor at WVU named John Temple. Really good book. It highlights 2 felons that's opened the largest pain clinic in Florida. And people in Appalachia would fly down or drive down and get thousands of pills and bring them back to Appalachia. But what happened from that was, DEA, law enforcement, we started cracking down and trying to stop the pills because we didn't understand addiction. And we thought if we stop the pills, we will stop this nonsense. We will stop the problem. It'll go away. And that wasn't the case. We didn't think what was going to happen when we made this plan to stop pills. Okay, so the pill mill crackdown was around 2010, 2011. I think it was June of 2011 where the pill mill bill in Florida went into effect pretty much overnight, shutting down all the pill mills. So we had this population of people that had become legally addicted to pain pills, and they were becoming sick, dope sick. Okay? And dope sick to me has been described to me by many people as the flu times 10, okay? And people will do anything not to be sick. Nausea, vomiting, deep bone pain. And so people turned to what was less addictive, less expensive and more readily available, and that was heroin. But what happens when you use heroin, you typically introduce it with a needle into the body, okay? Then we reuse that needle, and then we share that needle. So we have a lot of complications surrounding that needle, okay? Dreamland is another wonderful book to read to understand how drugs are moved from the cartels in Mexico throughout the United States. It came out in 2015. Sam Quinones is the writer of that. He also has a follow-up book that came out in, I think, 2021 called The Least of Us, and he made me really cry on that one. Great guy. He's a reporter for the LA Times, I think. So keep in mind that this has evolved over years, and it started before you were born. So we went to pills, to heroin, and then heroin to fentanyl. And I can actually remember events and dates when these changed in my hometown. These changes happened. Methamphetamines are on board now, and now we have something called xylazine. We don't know what's next, okay? We don't know what's next. Currently, there is no way to control the product that is on the streets of the United States. Meet the Press in July this summer did a special show on fentanyl, and it talked about chemicals being shipped from China to Mexico, where they have makeshift labs where they make the product, and they are shipped all over the United States and other areas of the world. Now, I wanted to give you an idea of what we were faced with, okay, and how things changed for us. Now, keep in mind, I come on the fire department in 1994. Yes, I'm older than I look. And I was 29 when I started on the fire department. I was a jeweler before that. That's a long story. So, you're on a fire truck. You do what you're told. You're doing your task. You're putting out fires. And then all of a sudden you're going on these little overdoses, and you're like, well, what's this? And you don't understand the big picture, but you know that life is changing on the streets as you come up through the ranks, okay? Things changed for us when we decided to do something about it. But our crime analyst that I have worked with for years, his name is Scott Limley, crime analyst for our police department, he made a heat map of drug arrests in Huntington in 2004, okay, 2004. So this is 10 years into my career. And so if you wanted to affect change in the drug trafficking in Huntington in 2004, you had to focus, all you had to do is focus on a 4-block radius around Cabell Huntington Hospital, 4-block radius. And look at 10 years later. $10 years. What do you think? A little out of control, isn't it? Okay. How do you affect change there? How do you affect change? Well, we had this gentleman named Steve Williams take office in 2013, and, information was given to him, and the police department actually took him on some police raids or some drug raids, and he's a talker. And they told him to sit in the corner and not talk, and which is very difficult for him. But he watched a couple drug house raids, and then he watched the people that were left suffering from addiction that were strung out in the houses, and it really, really bothered him. So in the summer of 2014, we put together something called River to Jail. And the idea was if a drug dealer came across the Ohio River into Huntington, West Virginia and sold drugs, they were going to go to jail. And within 3 months, $50,000 in overtime for our police department, there were 226 arrests made of mid and upper level drug dealers in our town. And within 2 weeks, you couldn't tell that one arrest had been made. Okay? That's how many people were waiting in the dark for their opportunity to sell drugs. Okay? So we decided we have to work on the demand side. We got to start helping people. We got to figure out another way to deal with this. Michael Botticelli, he had been the national drug czar. He had been in town. And so Steve Williams, who's an amazing leader, I give him so much credit for everything we've done in Huntington. He decided he was going to have an Office of Drug Control Policy in Huntington, West Virginia. Now, he knew I was a nurse because he had elderly parents, and I had taken care of them in the emergency room from time to time. So he called me to his office. I was a little nervous. I was a captain. You know, you never get called to the mayor's office when you're a captain on the fire department. He called me to his office and he asked me to serve. And I said gladly I would serve in this role as a member of the Office of Drug Control Policy because I was very frustrated. Here I was on a fire truck trying desperately to save lives, trying to revive the same person over and over again until I found them dead. And then I was also dealing with people in the emergency room being brought in, strung out over and over again, dealing with family that had lost a loved one and didn't know why. Okay? I'm an old paramedic. I went to nursing school at age 40. I was taught nothing about addiction or what to expect. Started working in the emergency room, and I was told, run this person off. They're just drug seeking. Oh, just get rid of them. They're just too difficult to deal with. And that bothered me because as a healthcare provider, I am supposed to do everything I can for my patient. I'm supposed to be a patient advocate. That is what I am supposed to do. And that's what I'm supposed to do as a fire captain too. I'm supposed to save lives. And I was very frustrated. And I didn't understand what was going on. So I made a huge effort to try to figure out why people were experiencing this. And I became a very curious, non-judgmental person. Why are you here today? May I ask what brought you here today? Okay, how did you get to where you are? I don't mean any disrespect, but how did you arrive in this situation in your life? And my eyes were just suddenly opened, okay? I was just blown away. And it's very humbling because, you know, we don't get to choose what family we're born into. We don't get to choose whether we're born into poverty or to a rich family, to one that cares about you, one that doesn't care about you. I also started making an effort to try to figure out what works to change somebody, okay? And I flat out asked people, what can I do for you that will make your situation better? What do I say and do that makes it worse for you? Okay, because I realized that a lot of healthcare workers, a lot of people on the front lines were making the situation worse for people because they were judging them and talking down to them and calling them pieces of crap and treating them like their life didn't have meaning. Okay? People suffering from substance use disorder are very fragile. That's what I found. And we need to recognize that. We need to re-educate not only the general public, but we need to re-educate the whole healthcare system when it comes to this area. The Mayor's Office of Drug Control Policy, and that's why I said yes to Mayor Williams, because I was already talking to my patients and finding out what was really going on. So when he formed this group, it was myself, it was the crime analyst, Scott Lemley, and it was a retired police chief, and his name's J.D. Johnson. Amazing guy. So I was the bleeding heart liberal, the nurse, and I had two very conservative white guys with me. Okay, so you can imagine when I call them one day and say, hey, I made an appointment for us to go see a harm reduction program with syringe services. And they were like, we're not medical people. You go look at this place. I made them go with me. So we drove 45 minutes away from Huntington to see this harm reduction program, dead silence on the way down. We get to this location. We see how people are responding to getting clean syringes and getting wraparound services, getting referrals to treatment, getting help with life in general to make themselves better. The two conservative white guys in my car would not shut up on the way home. This is a moral obligation. We have got to do this for our people. And that was the beginning of the path that we went down. So we talked to people like yourselves. We talked to ER staff. We talked to first responders. We talked to health departments. We talked to people suffering from substance use disorder to figure out what we needed to do to build a strategic plan to deal with what is going on in Cabell County, West Virginia. The first thing that we had to do was keep real-time data. We went to the CDC, we looked at their website, we made phone calls, we talked to the state, DHHR. We need numbers. You know, what's the up? Is there an uptick in HIV? Is there an uptick in hepatitis B, hepatitis C from sharing of needles? What's the number of deaths we had from overdose? How many overdoses have we had to date? And it was 2-year-old data. And we knew that the situation was changing so rapidly that we needed to develop a way to keep real-time data for ourselves. And we did that. It wasn't vetted data, but we had to keep it. So we used our 911 center, and all calls for overdoses were tracked. We tracked age, we tracked male, female, age range, you know, basic information, not HIPAA information. We could go through those calls and quickly, you know, mark out, you know, Grandpa took his heart medicine twice, so that's not a real, you know, that's not what we're tracking. You know, that's an accidental overdose, prescription meds, things like that. But we also knew at that time, because I was working the ER still on my days off, that 20% of our overdoses were being dumped at ER doors at our level 2 trauma centers. So we started asking them, every time somebody got dumped off at an ER that had overdosed, please call our 911 center, non-emergency number, and report it. And they agreed to do so. So we started keeping real-time numbers. And you're going to see the numbers. You got to keep in mind, this is a city of 46,000 people. Okay? Another thing we also did is we started educating people in our community. And we wanted a harm reduction program. We wanted things that were going to be controversial. You know, we are in the Bible Belt. And so we started meeting with small groups, no more than 10, because if you get a naysayer, it's hard to control. But we started with our faith community because we thought if anybody's going to oppose us, it's going to be the faith community. And they were open-armed us like nobody's business. Have the harm reduction program in our church. We will gladly take them in. What we found was our faith leaders were struggling. They didn't know how to help their congregation, and they wanted help from us. And we built a program called Faith Community United to help educate our faith leaders on how they could help their congressional members. So these are the things that we did from just 3 individuals in a mayor's Office of Drug Control Policy. Okay? Mayor Williams gave us the latitude to do that. You know, he actually backed a syringe service program when he was running for re-election the first time. But he trusted everything that we told him. First year that we kept real-time numbers was 2015. 944 overdoses, 70 overdose deaths. Okay, I thought this was bad. We knew it was going to get worse before it would get better. We just didn't know how much worse it would get. Okay. Talking a little bit about medical complications from our IV drug use. You have hepatitis B, you have hepatitis C, HIV. Huntington, West Virginia has one of the largest outbreaks of HIV in the country, and it's all from IV drug use. Okay? So it is definitely needed. Neonatal abstinence syndrome. We have a lot of babies that are born with, they're born addicted. And we have special services to help those babies get weaned off drugs. And we also have wonderful services to help moms get clean so they don't need to go back to maybe a drug-dealing boyfriend. Endocarditis, heart valve replacement, is very common in the youths that use IV drugs. Also, something that you can't deny is compassion fatigue, burnout, PTSD with your first responders and people on the front lines. And I will talk a lot about that because good leadership is recognizing and taking care of your people. That is number one. You have to take care of them. 2016, 1,476 overdoses. 132 overdose deaths. Too many. Now, I was talking to somebody earlier about, the average ages of people, 36, 37 was the average overdose overdose victim. The youngest I've ever been on was 12. The oldest is 79. Okay. So it's hard to see a 12-year-old that has overdosed. It's also hard to work on somebody who is overdosed and you look over and there's a 4-year-old or a 5-year-old watching you try to revive mommy or daddy, and you have no extra staff to comfort them while you're doing your job. So that's what causes a lot of that compassion fatigue. To date, our plateau was 2017, and I'll be honest with you, if you look at the data for the state of West Virginia, and I have a website that you can look at afterwards. We have a data dashboard site that they built for the state of West Virginia, so anybody can look at the data for Cabell County. There's 55 counties in West Virginia. You can compare. Huntington, Cabell County is probably about 4 years ahead of the rest of the state. For instance, our peak for overdoses was 2017, but the state peak was 2021. Okay, 1,831 overdoses, 202 deaths. Okay, 85% of those county overdoses are within the city limits of Huntington, West Virginia. Okay, within the city limits. So let me back up to 16. We'll talk about one thing that happened. August 15th of 2016 is the date that we went from heroin to fentanyl, pretty much like overnight. We had a gentleman, I shouldn't call him a gentleman. We had this dude show up from Akron, Ohio, and he was passing out free samples of a substance. It was carfentanil. We had 26 overdoses in a 4-hour period. Not one person died in that 4-hour period because by then we had naloxone in the hands of all our first responders. So you had cops giving naloxone, you had firefighters giving naloxone, and you had EMS giving naloxone. Our county runs EMS, our city runs police and fire. Okay? But guess what? Not one of those 26 people that were taken to the hospital tested positive for an opiate because fentanyl was not in the panel that they used to test at that time. Okay, they didn't want to use it because it was a $150 test, but within a year, they started testing for fentanyl regularly. So that kind of screwed us up that day. But we had seen this happen in other cities, so we figured that it might happen. We didn't know what that day would look like. We were very proud of the fact that we didn't lose 26 on that day. The problem was we lost people from that day within the next couple months because we didn't save their life long term. We hadn't set up a system to save their life long term. Okay? We could save them in the moment only. So this is a comparison of the runs by year. And the reason why I'm going to show this to you is you got to pay attention to your people as a leader. Definitely have to pay attention to your people. We went from an average of 3,500 calls a year over a 10-year period. We hit 16 and 17. Look how high our numbers jumped up. 5,000 calls for a fire department. 1,500 extra calls. A lot of extra wear and tear on a fire apparatus that's going to cost you $500,000. But you can't even measure the cost associated with the wear and tear on your people. And keeping an eye on them in a profession where we don't want to admit that we need help, that we might need to see a mental health counselor, or maybe talk about a bad accident. We're told to suck it up. That's how it was when I came on. I fought for mental health care for our first responders my whole career. And I think because I was the only woman for a majority of my career that they thought, that's just Jan being Jan. But turns out I was right. So in our rescue calls, we actually used our software to try to flush out how many overdoses we went on. In 2017, the fire department alone went on 1,241 overdoses, okay? So actually, we figured just by the basic data that the average firefighter in Huntington in 2017 probably saw about 5 young deaths a month. Okay? Think about that. So when I came on the job in 94, it was probably 5 or 6 years before I saw a significant number of deaths. Okay? These are not just deaths of young people. These are deaths of their friends, their classmates. I had one firefighter who was on multiple classmate deaths. And I don't know how you teach somebody to actually deal with that. So compassion fatigue is real with our first responders. And we were so focused on trying to make a difference in the lives of those suffering from substance use disorder that we kind of took our eye off the ball, which was taking care of our own first. You know, I actually had a firefighter look at me and say, "Chief Rader, you love addicts more than you love us." Boy, that hurt. Okay? But we made sure that we fixed that. Okay? It wasn't true. But I understand the perception, you know, because I was laser focused on trying to help people that were suffering, and where I should have been more attentive to their needs. So not seeing a positive outcome all the time is very stressful. You see people overdose again and again. You see the same person again and again and again, and then we find them deceased. And, you know, a lot of people throw up their hands like, why are we doing this? It's just so frustrating. So we need to be able to recognize that. We need to meet not only people suffering from substance use disorder where they are, we need to meet our people where they are. We need to meet the public where they are. We need to be able to validate people's feelings, and that's part of being a good, strong leader. You got to validate everybody else where they are. Had a lot of sick time usage, had a lot of behavioral issues, had a firefighter commit suicide. And that's rough. In 2017, more firefighters and police officers died by their own hand than died in the line of duty in the United States. And that's significant as well. And guess what? There's a stigma for us seeking mental health treatment, just like there's stigma with somebody suffering from substance use disorder. And we got to work on that. We need to turn that tide so there is no stigma. And that's what we're trying to do in Huntington. You know, local leaders, we've been able to do a lot of wonderful things in Huntington and Cabell County. We have people come from all over the country to see what we're doing in Huntington because we have made some positive strides. You know, we have a lot of partnerships. Partnerships lead to collaborations, which lead to innovative solutions to all kinds of issues, all types of crises. You know, leaders in Huntington were thinking outside the box, and we were certainly and remain outside our comfort zone. You know, if you would have told me that I would be part of a team that opened the first harm reduction program in the state of West Virginia, I would have laughed at you 5 years before I embarked on being a member of the Mayor's Council or on the Office of Drug Control Policy. Okay? We have to listen to people on the front lines. We not only have to listen to people on the front lines, we've been able to make positive change in Huntington because we listen to those that are suffering from substance use disorder. Now, are people going to bullshit you? Yeah. Are they going to lie to you? Yeah. Okay, but you can flush that out. Okay? But we got to know where people have come from. Okay? We got to know backstories. And we have to understand the backstories of our workers too. Okay? Has anybody in here seen the documentary Heroin? Okay. I get asked a lot of questions about heroin, okay? And there's a scene in the movie where a firefighter questions whether he has to give naloxone. I'm not required to give naloxone. Okay, y'all familiar with that? People think that's disrespectful. Okay, but they don't understand that first responder has a background too. What if I told you that he had been battling an ex-wife for custody of a child, and the ex-wife was suffering from substance use disorder, and he had been put through hell because of it? Gives you a little different perspective. So we got to keep that in mind as well. We have to provide necessary and changing education for our people. And that we have tried to do in Huntington. We tried to do it too soon without recognizing their efforts. We had some epic fails with that. I'll just be honest with you, and I'll get into that in a minute. Provide mental health outlets for your staff. I think that's key. And on their terms, let them decide how and where. Encourage self-care for all. I think that is huge. Best thing you can do as a leader is to encourage not only your own self-care, but everybody else's self-care. Because you don't know how long you're going to be stuck in the gang. Okay? I will admit that as the fire chief, I put my own self-care on hold, and I tell you what, you retire, and then all of a sudden you have this explosion of unprocessed trauma. So thankfully, I'm big in mindfulness. I'm really big in mindfulness. I've been using it since 2016. Love it. And without mindfulness, I probably would have had a rougher first year, retired from the fire department. So some of the innovative solutions that Huntington has actually developed through partnerships and collaborations. First, harm reduction program in the state of West Virginia. Right now it's on life support because of political hick-hack. Okay, we'll see how that goes. Naloxone in the hands of all our first responders. And we actually push that for the whole state. So the whole state requires that all first responders carry naloxone. We started a quick response team. It's a follow-up team based with our EMS service. They go with a paramedic, a peer recovery coach, specialist, a police officer, and a faith leader, and visit people within 72 hours of a resuscitation in the field. And they offer them services and try to get them referred to treatment. We started PROACT, a provider response organization for addiction care and treatment. It's a freestanding facility where if you want help from addiction, whether you have insurance or not, you can walk in and be plugged into the system within 2 hours. No questions asked, okay? If you really want help, we find out. We have Project Engage. It's a program in both of our healthcare facilities in Huntington where if you have a secondary diagnosis of substance use disorder, you can get help while you're in that hospital for getting that heart valve replacement or whatever else ails you, because people who are suffering from substance use disorder who use needles on a regular basis are medically fragile. And we also started, which is my pride and joy, Compass Navigating Wellness, and that is for our first responders. So just give you a little quick update. After our peak, because of those innovative services, our numbers went down considerably. 2018, 2019, 40%, that's huge. I don't know of any other area of the country that produced that. Okay? That's because of those innovative services that we started in Huntington. Then we had this little thing called COVID, right? So it affected us, okay? The numbers started going back up. Numbers went back up. And our first responders were really worn out between a crisis, an opioid crisis, and now a pandemic. It was a synergistic effect on our first responders and our medical providers. So our overdose numbers did go back up. The alarming was the overdose deaths. We found a lot of people deceased, not just from overdoses, but elderly that were afraid to go to a hospital because they were scared by the media, who would not venture out and get their prescription drugs filled again. So we did, unfortunately, lose a lot of people during COVID. So 2022, our doses are incomplete. It takes about 2 years to fully vet the data. So, but this is data you can actually pull off our dashboard. The reason I wanted to put this up here is so that you realize that a very large number of our overdose deaths are still fentanyl related. They've been over 80% since 2017. So that is, as long as we have fentanyl around, I mean, we're really going to have to push naloxone in the hands of everybody. Some of the current trends that we're dealing with, because this is an ever-evolving crisis. Drug supply, constantly evolving. Xylazine, which is in the supply now, causes these horrific necrotic wounds. I spend 1 day a week with a Dr. Sydney McElroy, and I help her provide free medical care for the homeless in Huntington, 60% of which suffer from substance use disorder. And we treat a lot of xylazine wounds. They won't go to a hospital because they're treated so poorly. Okay? They're treated, they're very fragile. They can't take you looking at them saying, you could have died. What were you thinking? They just can't take that. They're very ashamed of what's going on. They're very vulnerable. And it's a very sad situation. I suspect that a lot of people that I deal with at Harmony House when I'm there 1 day a week, I suspect a lot of those people were watching me revive mom and dad when they were little, because it was probably about 50% of the time we had a child involved back in the day when we were dealing with the overdoses. So the biggest work shortage in the state of West Virginia right now, mental health care workers. Okay? The thing that we need the most. We lost 1/3 of our paramedics in the state of West Virginia because of COVID. They left the profession, never to come back. So we got a lot of work to do. We got to train a workforce to help get through what we're dealing with. Currently, the state of West Virginia is meeting 13% of its mental health care needs. Nationwide, I think it's 30%. Some of the solutions that we've come up with for our current trends involve a crisis intervention team. We actually have a mental health care worker and a police officer that can respond real time to a mental health crisis. We're seeing a lot of psychoses from the methamphetamines that's in the product. Sometimes that's temporary and sometimes that's long-term. We also have, we are building a shared database that is HIPAA compliant, so that if one of our partners loses somebody, they drop out of care and they pop up at another partner's business, they can look at the shared data. Or that partner, when they lose that person, can call our case navigator that we've created with the SAMHSA grant that we have, and we can send some street outreach folks to try to locate that person and reconnect them to services so that we don't lose them completely. We are expanding a low barrier shelter. Homelessness is on the rise, not only in Huntington, but nationwide. A lot of reasons for that. Substance use disorder is a big driver of homeless situation in Huntington. We currently have a low barrier shelter that's in a chapel for our city mission. It has 27 cots. Every night they have at least 40 people in there laying on the floors and things like that. We're trying to expand and build one that is larger with showers, extra bathrooms, and we're also going to build office space around there and have low barrier medically assisted treatment available to individuals. And we are also expanding access to telehealth. So what I really want to talk to you about, though, more than anything, is Compass. Okay? Compass is a program that we developed for our first responders to provide them with the support they need to be better at their jobs and to retire whole body, mind, body, and spirit. So they're not angry. They don't fall victim to substance use disorder, drinking, you name it, which are all very common in my profession because of what they see. So we have about 180 combined police and fire currently. Our police department is 20 officers short. That's another big work shortage that we have. A lot of people don't want to be a police officer right now. We have certainly an increase in our call volume. And we had an independent evaluation done, and that evaluation found that first responders in Huntington have significantly higher stress PTSD than the general population. So Huntington was awarded $1 million through the Bloomberg Philanthropies organization in 2018. It was a Mayor's Challenge grant, and we applied for it in 2017. And what they did is they chose us as a finalist, and the finalists were given $100,000 to test what they wanted to do with the money. And the goal was to take a problem in your area, in your city, and build solutions that could be replicable around the country. And we took the $100,000 and we decided to try to tell our first responders we were going to educate them on substance use disorder and how to be better stewards of people. And it was an epic fail. They screamed and hollered and were like, "You don't care about us? How do you expect us to take care of anybody else when you don't take care of us?" And it was a safe space. We were like, "You can say whatever you want in here." And it was painful for us as leaders. It was painful for me. It was painful for Mayor Williams. But we wanted to fix that issue. So we backed up. We reported to Bloomberg our epic fails and how we were going to correct it. And we were given $1 million because of it. Compass is driven by our first responders. Chiefs don't have anything to do with it. I've never had anything to do with it. It's for them. They have focus groups. They meet regularly. They decide what they want, what they need moving forward. Okay? I consider it a huge success. We have mindfulness. If you would have told me that the guys would want yoga in a fire station 2 days a week, I would have laughed at you 15, 20 years ago. Guess what? We have yoga in fire stations 2 days a week, and they love it. And the yoga instructor brings her dog, so the dog does yoga too. We have cooking classes. We have nutrition classes. We have family nights. We have nights where mom and dad can go out and enjoy a movie, and we provide babysitting services for the kids. It's driven by our first responders. And it's an amazing program. This is pretty much what we found. We thought that they were being affected by drug overdose deaths. We thought that was like the big thing that was affecting them. But what we found is that was the tip of the iceberg. That was just a very small part of it. COVID was a big part of it. Relationships, lack of personnel, training, work environment, all of it. Okay, so this is what we found out. And guess what I heard? "Oh, this is bullshit. The mayor's going to just pull the rug out from under us. You don't really want to help us." That's what I heard. And then they saw that we actually cared, and it was all about them. And they got to decide. And now they love it. Now, we do have some naysayers, I'm not going to lie. We have 3 different groups. We have some old staunch, "you can't change me." Okay, that's a generation that's just going to have to move on. Maybe they're so damaged that they don't want to deal with the trauma that they have experienced. And we have that movable middle. I got 10 more years. I might as well figure out and see what this is all about. New people, they come in, guess what? They're part of the program. An hour a day of their training is involved with Compass. We have 2 embedded coaches. We have a mental fitness coach and we have a physical fitness coach. For 1 hour a day, they are with one of the Amy's. We call them Amy Squared. And guess who hired them? The first responders. They did the interviews. They had the focus group. They chose who was their physical fitness coach and their mental fitness coach. They had buy-in on who was hired to run this program for them. Some of the services we offer are just amazing. The acupuncture, nutrition, the massage therapy is really big. We actually built a center for them, and they have three big giant massage chairs. They're fabulous, by the way. As a retiree, I'm allowed to use the wellness center now, now that I'm no longer the chief. We do mental fitness coach or mental health check-ins, and we're getting ready to make that mandatory per year. And now Amy Jefferson is our mental fitness coach. This is Amy Squared. This is Amy Jefferson. You know, she has trauma in her past. She lost a sister to homicide. That's key. She can relate to the guys, and they can relate to her. And she's an extraordinary person. She makes a difference. But a well check-in with them is just sitting down, how you doing? She doesn't do counseling. She'll refer you to counseling if you need counseling. I know of probably at least 15 firefighters that have had advanced treatment for PTSD because of this program. And they're one of my favorite guys on the fire department. He's a friend of mine. He's a captain now, and he said, Chief Rader, I was an asshole to my wife and kids. Now I'm a asshole in recovery. But he's had extensive treatment for his PTSD, and he was amazed how far back it went. It went back to his volunteer days before he even became a professional firefighter. Just a great, super, super guy, really into mindfulness. He and I went through a mindfulness coaching class. Amy Hanshaw here, she's in her 40s. She has a degree in exercise physiology, and I just love to watch her go work out with the cops because it is hilarious. She can work them all under the table. It's really great. So they actually develop the programs, and they run the program. And I support them wholeheartedly. We had a rough start because of COVID. 25% of our workforce were utilizing Compass services in the first quarter of 2021. But by the third quarter of 2022, 73% of our police and firefighters were utilizing services on a regular basis. To me, that's huge. Firefighters that utilize Compass services report a 2-time higher job satisfaction, 20% more satisfied in their ability to manage relationships, solve problems, acknowledge and discuss mental health issues. Something that we have not released yet, but we will release soon because they're still doing the data. Fire crews that utilize Compass are responding quicker, up to 13 seconds quicker to calls. Now, if you have a house fire with somebody trapped, 13 seconds could mean the difference between saving a life and not saving a life. So that's huge. Lessons learned personally, and what I like to share with everybody else, are the fact that substance use disorder is a very complex medical condition, and we need to treat it as such and not as a criminal act. That's one of the problems that we have with fighting this situation that we're in. Shaming, judging, blaming to attempt to manage somebody's behavior does not work, okay? We have to meet people where they are. Flexibility is key. We have to be able to adapt and overcome as the situation changes in front of us, because it does change actually daily. You'll see different product on the street for 2 weeks and then it's gone. You see it in the symptoms of your patients. You see it in their behavior. Partnerships are a must. Partnerships lead to collaboration, which lead to innovative solutions for us. And partnerships and collaborations create an infrastructure that can then be utilized for other unforeseen crises, such as going from opioid epidemic to adding a pandemic on top of it. What I would like you to take away from this as you journey into reality from your education is communication is key. You have to have good communication skills. And the biggest part of that is listening. You got to be able to listen and hear and validate what people are experiencing. I think that is key. You got to be flexible. Be courageous. Being courageous, you got to be okay with failure. Because let me tell you what, I've learned a lot more from my failures in life than I ever have my successes. Compassion, be compassionate. It changes the way you lead when you open your heart and see how everybody else lives. Encourage self-care for not only yourself and for your people. And another, stay kind and positive, because those are two things in life that are actually free. Anybody else like Brene Brown? Love me some Brene. Integrity is choosing courage over comfort. I'll take that any day. Mayor Williams, Huntington is a city of uncommon compassion. Websites, if you're interested. If we have time, I'll take questions. If not, that's okay too.
What's that telling? Yeah, please step up the microphone and say, why did people sugar? Well, why you get first question? This lady that wants to talk. But her fee from today donate help for my but she why it's very passionate about what she does.
Which side's going first?
Hi, Ms. Rader. So I've heard that Switzerland is a success story when it comes to the harm reduction programs. How can the U.S. get there?
It's tough because it's politically charged right now, and I think it's going to take a lot of difficult conversations. And but I think we'll get there. I think we will. I think that pendulum always swings, and we can't be afraid not to have those conversations. I get yelled at a lot, but I'll take a cussing over a desk any day.
Thank you.
You're welcome.
Thank you for coming to speak to us, ma'am. What kind of policies do you think you enforced effectively that prevented the failures that we're seeing of harm reduction centers in major cities like Chicago and San Francisco?
I think that the biggest thing that you can do is be honest and upfront and be very transparent. And I think a lot of cities try to enact harm reduction programs without spending the time to educate the general public and talking openly about it. We talked a lot about it before. We educated for 6 months before we opened it.
Thank you, ma'am.
Forsyth.
Good afternoon, ma'am. Thank you for coming out. So I've lived in both Wheeling, West Virginia, and up in Bridgeton, Maine, which is also just kind of middle of nowhere, Maine. And seeing the effects of the drug rates and crime rates rising and homelessness on the rise, I was wondering if you had any suggestions for how civilians not associated with major church groups or police force or first responders could also aid in efforts to both help continue the mental health safety of the first responders and aid in lowering these drug rates, helping the people who are struggling with these.
Well, it's one person at a time. You don't have to be a church to have a coat drive. You don't have to be a church to have a food drive. I don't give homeless people money. I won't, but I'll take them into a restaurant and I'll buy them a meal. Sometimes just listening to somebody, you can't save their life or solve their problems. They got to do that themselves. But what we can do is be kind to people. And I think that kindness breeds more kindness.
Thank you.
You're welcome.
Based on everything you've seen and worked with in your career, how do you foresee the overall number of ODs happening, the trend-wise, now that COVID-19 is not really as much of a prominent player in the environment?
Well, I think that we have, I think we're on generation 3. right now from pills to where we are now, generation 3 of people suffering from substance use disorder. Now it's trauma-based. It's not getting hooked on pills. If you ever have a chance to listen to a Dr. Stephen Lloyd, who was his character, the character in Dope Sick was him. He is in long-term recovery. He says that you need 3 things for addiction to be ripe, and that is genetics, trauma, and opportunity. So we need to deal with trauma. We gotta handle trauma in this country and give people the resiliency and the tools that they need to stay healthy. Because a lot of trauma I've seen. I see how easy it would be to numb and not deal with reality. So, but we got to work on that trauma.
Thank you.
You're welcome.
Hi there, ma'am. So you worked with a lot of groups to accomplish all these goals that you wanted to achieve. Did you work with county prosecutors at all to work something out?
We do, and we work with our law enforcement too. We try to, still on the books in West Virginia, drug paraphernalia, that's a ticket, but that complicates somebody's life if you give them a ticket for drug paraphernalia. So, the crisis intervention team is helping our law enforcement and our attorneys at the prosecuting attorney's office. They are actually getting more training on mental health first aid and what's going on out there. So there is a tide that's changing where we are.
Do you do any additional work with public defenders as well?
Most of them are on board anyway. We actually, we have an advisory group for the grant that I run, and we invite anybody that's a partner to come and take mental health first aid. Our public defenders are awesome. They're pretty amazing. They actually get people in drug court instead of and trying to get their sentences reduced and things like that. They're amazing. So, thank you. You're welcome.
So thank you for coming. So I'm a BLS provider in a very poor and rural county in Central Virginia. So what's the role of providers and young officers in fire and EMS systems that don't have the funding, staffing and backing for citizens and personnel like you do in a more urban area?
It's tough. It's tough. We have areas of West Virginia that struggle. Like I said, if we lost a third of our EMS workers through COVID, you probably did as well here. There's a lot of grant funding out there right now. There's a lot of free. Look at your libraries. A lot of times they'll have free workshops on writing grants. I started writing grants before I knew how to write grants. Sometimes we have to partner with churches, find another partner. There's got to be somebody that you can partner with for funding or for what you need.
Thank you.
You're welcome.
Greater for your time and your insight. On behalf of the Virginia Buffet Institute, Superintendent Cadet, staff, and faculty, let's thank you.
Thank you so much. Thank you so much. Thank you all.